Mr. Abdullahi Abarod, who is the Research Director at Healthy Africans platform. Mr. Abdullahi is a global health advocate, harm reduction scholar in Germany, Royal Society of Tropical Medicine and Hygiene Student Ambassador, Global and WHO Antibiotics Guardian, drug policy and harm reduction advocate, and health researcher with more than 50 publications in international peer-reviewed journals. Besides, he assumes the professional role of the Director for Research in Swiss Africa Research Hub, Ole Health Magazine Organization, Healthy Africans Program Platform, and Brain Builder Youth Development Initiatives. He's the only African selected as Youth Advisor for the Data Bank Mental Health Project organized by Cambridge and Oxford University. He is selected as a data contributor for Oxford COVID-19 Government Response Tracker. Let me invite Mr. Abdullahi Abarod for his presentation. Over to you, Mr. Abdullahi.
Yeah, thank you very much. I really appreciate. My name is Abdullahi Abdullahi, speaking live from Nigeria. And the topic I would love to speak on is raising community health voice, to achieve universal health coverage from in low and middle income countries. Before I start, I would love to break down the terms, which is very, very important. Community health voice, universal health coverage, and low middle income countries. You have to start with what is community health voice? Community health voice is the power given to community on their health insurance, their health progress, their health development, and their health equity. What is universal health coverage? Universal health coverage was enacted by United Nations when they sit down to create sustainable development goals in 2015 to achieve what is known as health inclusion, health for all. That is, we have a situation whereby everybody is equal to have equal rights over the best healthcare accessibility and the healthcare treatment. Then low and middle income countries. We break it. Low countries and low income countries and middle income countries. We have low income countries are those countries that the standard of living at the same time, their economic power is low in nature in terms of their economic progress, their infrastructure, their development, the way the budget of the country is very low. Then we have middle income countries that are a little bit standard than a low income countries in terms of middle development in their infrastructure, in their economy, and in their developmental stage, like as a country. Why I take middle and low income countries is that low income countries are countries that are low and exposed. The power of their exposure is very low. And the world, the involvement and development of the world are so in low contribution to them. So I'll go in form of health. That is my focus today. Now to start with, why community health voice? Why it is needed and why is it important? I'll go by low income countries first. Citing an example, we have countries like Somalia, we have countries like Afghanistan, we have countries like Zambia. In Africa, we call low income countries, we call them, I don't remember the name they call them. We call them countries that do not share border with ocean, landlocked country. That's what we call them. So they are highly stuck with poverty. Some are stuck with conflict, and some are stuck with low standard of living. These actually pose a serious threat to the level at which they receive proper healthcare system. So now we have a UN development called Universal Health Coverage and SDG3, which is health inclusion and health equity. Whereas in these countries, they are not perceiving or they are not enjoying the dividend of this universal health coverage. That is, they are highly forgotten. It is only people that have enough and sufficient money that are taking care of themselves. Those that are now in community levels, they have low accessibility to healthcare center. Even if they have access to healthcare center, the health treatment and the health inclusion they will receive, it is on a low base because they are always having an inadequate supply of treatment, shortage of drugs, low technical know-how, that is low healthcare professional that can attend to their situation at the same time. Thereby, this community now go on a rough way to attempt to their healthcare challenges. That is, they have that brings about the inclusion or the development or the rampant stage of quack professional. The quack professionals are now in subgroup. Now, they can be in form of traditional medical healthcare practitioner, quack nurses that doesn't have a qualified healthcare certificate to attend or to treat any patient. And this is the development stage is really rampant and have already started developing in most African and Asian countries that are included in low middle income countries. Why is it that we need voice for community health? When you see the inclusion or the statistic or report or findings that people have done, research people have done on different healthcare diseases or different healthcare problems that occur in these countries, they comes from communities, rural areas they have low intervention and low inclusion when it comes to health equity and health inclusion. This does not bring or is not feasible to what UN is aggravating for and is advocating for, which is universal health coverage, that is health for all. Whereas we are in 2021, remaining just 9 years to make a report on what SDG has achieved. The question that has now been raised is that, do we truly, at the end of 2030, do we truly say that we beat universal health coverage and health equity? This is the gap that it needs to be filled if at least 80% of universal health coverage will be achieved. Until then, we will always be beating around the gap until this gap is being filled. And how will the gap be filled? It's by including, it's by intervening, it's by collaborating and partner with this rural and community voice. Because until their voices are being raised, then the whole world will know what should be done. Yeah, I know about different institutions are working previously to improve the healthcare inclusion of people. But the mistakes a lot of people are making, including the stakeholders, they are looking away to, or they are not looking deeply into this community voice, into this community health, into these minorities. I can call them sometimes they are minorities because their voice are not being heard. Looking into statistics report, I make an example. As for Nigeria, the high percentage or the high statistic that have been reported over maternal mortality in the world, Nigeria contributes to 20%, which is a leading country in the world when it comes to maternal mortality. And looking down into why is this percentage so high? They are not high in rural, they are not high in urban area. They are mostly common in community health, community areas. They are mostly common in rural areas. They are mostly common among minorities that doesn't have access to proper healthcare intervention. That doesn't have access to the diversification of the mixture of quality and high renowned professional healthcare. That is the major reason why the case keep increasing, keep aggravating. And all what we talk about is statistic. Then what about the intervention? What about the action that is being needed? And part of the action is advocating, is campaign. And the campaign leads to what is known as the voice. Until their voice is being heard, the stakeholders, the healthcare professionals, the health institutions, both regional, both local, both national and international, could not know that this is actually going on. Some reports from London School of Tropical Medicine that specialized on maternal mortality find out that most in Nigeria alone, about one out of 10 women die every 30 minutes when delivering babies. Where does it happen, or where does it occur? Only occur in communities, occur in rural area. The most prevalent case are not most finally in urban, because they have easy access to healthcare intervention at the time they are needed. Go to communities nearly before you can go, or before you can access to healthcare, primary healthcare service. The place where primary healthcare service is situated is so far from the place where people are living. Then they can say, oh, it's because of some condition, some demographic characteristic that contribute to that. Maybe in terms of service, in terms of the space, in terms of how the environment the people live. So compared to the healthcare professional, they are provided to them. So nearly when there's an emergency where there's supposed to be adequate intervention, then the people that are supposed to attend are not found. Thereby, people that are then used, according to an economist, they will say, you use what you have to get what you need. That is, people use some traditional knowledge to attend to this issue that need an adequate intervention, that need an adequate diagnosis. Whereby people just attend somebody that is having an headache, and the headache is majorly as a result of maybe headache and malaria, headache and fever. So that is as a result of maybe a malaria case or typhoid. Then they will just prescribe a traditional medicine that has huge lead compound that will actually suppress the situation at that time. But at the same time, we aggravate another thing in the woman's system, because there is no proper diagnosis and there is no proper healthcare intervention. That have been increasing a lot of burdens in these low and middle income countries. And whereas stakeholders, we just budget about, oh, we budget this also to healthcare system, and we hope to achieve this. Whereas when you see, or when we see them and do research about what has this money done, or what has this budget done, or what has this intervention done, at the end of it, you will see that you only do little, because they are not focusing to where the root of the problem are coming. That is why it is needed to raise these community voices in terms of campaign, in terms of healthcare system intervention, because if there is an adequate intervention, there will be positive healthcare outcome. And that is what we needed. If there is positive healthcare outcome, there will be what is known as universal healthcare coverage, which is equate to health equity. Even though there have been some debates to the SDG when it comes to the equity, inclusion of people in terms of poor people equating to rich people in the same feed, in the same vicinity, in the same line, to achieve healthcare inclusion, to achieve any other thing, that is to enjoy the dividend of any other thing. But we find it out that there have been a very long line of gap whereby rich people are only having access to quality healthcare centers, to quality healthcare materials, than or to the low income people that are struggling. They are in rural area, they are minorities, and their voices are not being heard. Now, if we can raise the community healthcare voice, if stakeholders can look into if primary healthcare intervention can be improved and can be common and rampant as in urban area, if these people, communities people, primarily, they have access to everything they need when it comes to health inclusion. If they can do that, if their voice on what is really happening to them can be heard. There are some communities that what they are suffering is neglected tropical disease, NTD, such as snake biting, such as leprosy. Another community may be suffering from malaria. Some other communities, their problem is maternal mortality. So if each community are being given their voice over what is their problem that pertain to health intervention, that pertain to the problems they are facing when it comes to health care system, if that can be done, if their voice can be heard, there will be what is known as healthcare inclusion, which is universal health coverage that the UN and SDG is trying to generate. Then until then, if we don't do that, if we don't raise, if NGOs don't intervene, there are little to what NGOs can do because there are little to what changes that can be done. And changes reflect from most stakeholders and the amount of money you intervene, not only money, about the system planning over what and what should be done. Because these communities have different sets of what is their problem. Every community has their own problem. And if there can be local intervention over hearing the voice of each community over what have been their problem for ages, and what this primary health care center do not have or cannot intervene at or cannot do, that alone can pave way to the new dimension and can bring what I call a new revolution to the healthcare system. At the same time, with strengthening different countries, mostly from low income and middle income countries, on their healthcare intervention and healthcare system. Until then, achieving universal health coverage will be so hard and will not be feasible to achieve. Thank you very much.
Thank you so much, Mr. Abdullahi, for that excellent session. I think you are doing an amazing job, and we know that we all have a lot more to achieve. We have a lot more to do towards achieving these goals. But when we see youngsters like you raising your voices towards the cause, it gives us a lot of hope. Thank you so much for joining us today and inspiring us.
You're welcome. Yeah, you're welcome. Yeah.